My name is Michaela Clark. I'm a public services librarian at the Calvert Library. We are thankful for the opportunity to partner with the Calvert County Commission for Women to bring you information about the impact of COVID-19 on violence in our homes and to share local resources you can turn to for help. This webinar is being recorded and may be shared via social media at a later date. Please use the Q&A feature, which should be in the bottom of your screen, to pose general questions to the panelists, being careful not to share personally identifiable information. If you need immediate assistance regarding personal matters, please use the contact information you see on your screen. And I will read that for you so you'll have it clearly. If you have an immediate emergency, you may contact 911. To contact the sheriff non-emergency number, it is 410-535-2800. There are 3 24-hour hotline numbers. The local phone number is 410-535-1121 or 301-855-1075. You can also use text 443-771-7037. And the national 24-hour hotline number is 1-800-799-SAFE. The numbers for SAFE are 7223. And we also have an online community resource, which is www.ourcalvert.com. We have with us today a great panel of experts. We have Joan D. Winship serving as our moderator. She is the chair for the Calvert County Commission for Women. We also have Jennifer Moreland, director for the Calvert County Department of Community Resources. Jennifer L. Edwards, advocate, Crisis Intervention Center, Calvert County Health Department, Safe Harbor Shelter. We have with us Catherine A. Marsh, Assistant Chief Special Victim and Family Violence Unit of Prince George's County State's Attorney's Office, and the treasurer for the Calvert County Commission for Women. With that, I'm going to turn things over to Joan Winship to moderate this webinar.
Thank you very much, Michaela. On behalf of the Calvert County Commission for Women, our thanks to the Calvert County Public Library for hosting us today on this important topic, the ongoing pandemic, domestic violence in the time of COVID-19. First, let me just tell you briefly about the Commission for Women. It's a volunteer and appointed commission of the Board of County Commissioners. The commission is charged with identifying issues and concerns about women and girls, informing the public and our public leaders, creating opportunities, and also giving recognition to the achievements of women. Over the years, the commission has been instrumental in establishing community resources that are available to address challenges women face. In particular, some years ago, the Commission helped establish the Safe Harbor Domestic Violence Shelter and the Crisis Intervention Center a few years later. So the Commission's long been involved on the topic that we're talking about today. Times of challenges and stress often bring time of also abuse and violence for people of all ages. These past 3+ months of the COVID pandemic, we've all been limited, frustrated, uncertain, and stressed. And this is not just an issue for us locally, but indeed abuse and violence in our homes is an issue nationally, as well as even internationally. Home can be a safe haven, but for many it can also be a dangerous place. Right now, governments, nonprofits, non-government organizations, health and justice systems, even the United Nations at that high level, are recognizing the need to address issues of domestic violence. There's a terrible global surge, and there's a need to pay attention and to respond to this second or ongoing pandemic that exists not just now, but year after year in every society. We're here today to discuss these challenges and learn from experts the resources that are available to us in Calvert County. And we will be focusing locally on this. So I'd like to turn first to Jen Edwards, who has been director of the Crisis Intervention Center at the Calvert County Health Department. Jen, would you start us off by explaining why violence in our homes is so important for us to be aware of, particularly now, and especially in light of the impact of this virus?
Certainly. When an individual experiences violence in their homes, and when we talk about intimate partner violence, domestic violence, we're talking about any form of power and control that one individual utilizes over another. So it's not necessarily just hitting or physical violence, but could be threats and intimidation and other forms of power and control. That is what it's about. So particularly during the height of the pandemic, many abusive individuals were then furloughed or lost their jobs, were teleworking from home. And so the abusive partner and the victim were around each other 24 hours a day, 7 days a week. And that, of course, along with financial concerns, other concerns, heightens the probability of an explosive violent act to occur in the home. And often we think, well, maybe it's just them or just my neighbor going through this. But in fact, domestic violence not only affects the family unit, it affects our culture, our society, our county as a whole. Individuals who have been abused, can't go out and join the workforce. Their children model after what they see, be it the violence or be it the victim hiding from the abuser, something like that. So it becomes a generational effect, generation after generation, and it in fact poisons our county as a whole.
Thank you. Catherine. Catherine's a member of the Commission for Women. In fact, she's treasurer, but she's also professionally assistant chief of the Prince George's Special Victim and Family Violence Unit. Catherine, what have you been seeing as signs and causes of family violence that may be the same as your ongoing experience, but is there also some differences that you've noticed facing everyone today?
Well, many of the things are what Jennifer just mentioned. It's the heightened stress that's in the environment. We know when there are additional stressors on the family violence is likely to increase. So when we are talking about individuals who may not be working and now there's financial hardships in the family, that's additional stressors that lead to the more volatile situation. We know that individuals who may have substance abuse issues, when they're not able to actually go to meetings or do their routine that helps them maintain sobriety, that can also be increased stressors to the family. But we also know that specifically with COVID-19, the pandemic and the stay-at-home orders, there wasn't the ability for victims, or at least for victims, to believe that they could get out of the home. You can have that power and control dynamic, and now you have an abuser who's in the home 24/7, and the victim or surviving family members don't have a way to leave the house because that person is controlling the keys to the car, refusing to allow them to leave. And there's also been just some misinformation where people thought because things were closed down that they may not have access to shelters or to the hotline numbers, or that police weren't responding because it was a non-emergency. And part of that was just getting out the word and making sure everybody knows that no matter the pandemic, now, later, that domestic violence shelters always remain open, the hotlines are always answered, and police officers will always be responding. Nothing with regard to a health crisis will ever stop those kinds of resources being available.
Jennifer? Jennifer Moreland is Director of Community Resources, which covers a whole gamut of agencies and commissions in the county. And Jennifer, when we think of domestic violence, we mainly think of our spouse or a significant other. But in fact, family violence can involve a lot of other people. Can you explain this to us? What other groups and people are we really talking about?
Sure, and I'll talk a little bit about the data as well. So when we're talking about other groups of people, we're considering older adults, the elderly that are living in our households, as well as, of course, young children. And when you look at Office on Aging is a division that Community Resources oversees, and we work closely with Department of Social Services. And one of our key goals is education. And so when you look at data from last year compared to this year, Child Protective Services and sexual abuse investigations conducted by Department of Social Services were reduced by half. And this trend is not only in Calvert, but this is statewide, and it's due to the primary reporting entity being the public schools being closed. However, adult protective services cases, referrals, and numbers remained about the same. And adults in this situation are increasingly isolated and need more assistance. So to give you an example of how many adults are served through our senior program, we have about 175 vulnerable adults and seniors that we reach out to on a weekly basis. However, I'll say since the beginning of the pandemic, our call volume has increased by 20% for that population. And so that's concerning. In our office, in the Community Resources Office, which also takes calls, we saw a 77% increase in volume due to this response. And most of those calls were from seniors needing services. So, you know, we see that there's definitely a need for more assessment that can be done on a county level. Right now, of course, we have case managers, both through DSS and Office on Aging, that work with our seniors that can try to identify these needs. But sometimes it's really having somebody go out to the home, like a traveling nurse, that can see the kind of condition that seniors are living in to really evaluate how they're, you know, their circumstances and how they're being treated, whether it's by caregiver or by family members. And I think in many cases, families may not realize that they are putting a loved one's life in jeopardy. Certainly, you know, they may not be aware of the kind of care that their loved one might need. So sometimes, you know, there is an unintentional kind of abuse going on, and other times, which is more like neglect. But other times it's very intentional, and you'll find issues like financial exploitation. And so in cases like that, when we receive referrals, we're oftentimes working very closely with Department of Social Services and with the state's attorney's office to make referrals. I think the more kinds of supportive services that we can have in our community and really reach out to those seniors, give them a lifeline so that they can connect back with you, it's critical. The Caregiver Services Corps, Calvert Hospice, you know, there's a number, the Senior Companion Program, there's a number of programs that are volunteers, but those are more touch points in the community for our seniors that can connect with them and identify if there is an issue, if they're experiencing some kind of violence. I think once this community fully reopens and referrals resume to the kind of the pre-pandemic levels all around, we are really going to have to coordinate well as a system because we don't know what kind of volume we're going to be seeing when people return to schools, to senior centers. Certainly, I am concerned about that.
I know that when we spoke, some of us were speaking before, one of the questions that was raised was information about the data, Jennifer, that you were speaking to. And initially, in both child abuse as well as hotlines, rape crisis, apparently the data, actually the number of calls went down because of people the limitations. And Catherine, can you maybe speak a little bit more about why that was so, especially for children, and what has happened, or what you anticipate will be the case? Children don't have access to the same people necessarily right now. You're on mute, Catherine.
Because my phone was beeping, I was muting during that time. But you're absolutely correct. The majority of child abuse cases actually come through reports from the schools, from sports, or from daycare. And so at the point during the pandemic where children didn't have access to schools, they didn't have sports teams, and they weren't going to daycare or to counselors, their ability to report to somebody was non-existent. And therefore, a child's not going to say in the home about the abuse going on at the home. They need somebody on the outside. And when you take that away, there's nobody for them to report to, which is why the numbers were down. I will tell you that every single, I know social service, child protective services office, law enforcement, and prosecutor's office are now gearing up. We're expecting the calls now that daycares are starting to reopen and some counties can begin some kinds of sporting events. We're expecting the calls to basically double or triple where they were at this point last summer. And it's just because it's the first time the children are going to be able to have somebody to report abuse to.
And Jen Edwards, you've mentioned similar expectations for the shelters or the crisis center.
Absolutely. When the pandemic first hit, our crisis hotline took a dramatic dip. And again, because we assume most of the abusers were at home with the survivors, we are now gearing up for probably a 50% increase or more from last year of crisis calls, domestic violence, survivors seeking shelter with their children. So we are gearing up as well. We can feel it coming.
How are you gearing up? What opportunities, and do you anticipate there's enough space or responses that is available that you will need?
Luckily, with the shelter, Safe Harbor Domestic Violence Shelter, we have good collaboration with local shelters. So we will be working in conjunction with them to find best fits if survivors are looking for emergency shelter, temporary or long-term housing, things of that nature. So, and Crisis Intervention Center looking to beef up the staff abilities as well.
And Jennifer Moreland, is that what you anticipate, or how are community broader resources gearing up or getting ready?
So we applied for a community development block grant through our office to contract with a visiting nurse. And we think that that traveling nurse program is going to be really crucial to connect with seniors that are isolated and identify their needs. Many of them, and they will work very closely with case managers, both from Office on Aging and Department of Social Services in that process. And so we're hopeful that we'll receive that funding. We'll know in July. Certainly if there's a peak again in the fall, that position is going to be crucial. This is a long period of isolation for anybody to have to face. So whatever additional supports we can put in place, I think is critical. We also have a issue with seniors becoming homeless. And so that was another piece of the grant that we applied for community development block grant, was to have a housing and homeless case manager. When people are more vulnerable, they're more likely to face different types of abuse. And certainly when you're not in a stable home environment, you want to be able to have other housing options. So I think having a case manager to help people navigate that vulnerability and find housing is going to be critical.
Jen, for the people think about the hotlines, can you explain kind of how they are, what we have locally, how that connects with hotlines at different levels, and particularly those on domestic violence and sexual assault?
Certainly. So, Crisis Intervention Center, which is located in the Calvert County Health Department, is considered a comprehensive program. And one of the requirements of a comprehensive program is to have a 24-hour hotline available. So individuals can call that number 24 hours a day, 365 days a year, and be able to speak to a live person, a counselor, who will listen to them, help them out with the current stressors they may be facing, provide resource information, or even get them prepped to be set up for an appointment with a counselor or therapist at Crisis Intervention Center. So that is for Calvert County. We noticed, like I said, during the pandemic, people were not able to call, but we figured they might be able to text, which is when we instituted that text line. So we're believing that's going to pick up as well. And then there's always the national numbers that people can call as well. And we have that information on one of the screens for us.
And how does the national level connect with the local? Because you call somebody at national level, you don't know where they are, what they do. How do they understand or know anything about referrals or what someone can do locally?
We keep good collaborations with individuals at the national network. They know about us. We're registered with them as a comprehensive program. So if someone were to call their hotline, the individual that they're speaking with can then, type in Calvert County, Maryland, and find the local numbers of resources and connect them with that so they can get help in their area.
Catherine, what kinds of things are available, especially for children or child abuse situations?
Well, so the hardest part right now is obviously children don't have a way to make the report. So that's why I said we're expecting this change now that daycares have started to open and some of the other programs for youth in the county. Once we start seeing those reports that come in, within Calvert County, and in fact, every county now in the state of Maryland, there's a child advocacy center. And so when reports of abuse come in, they go either to Child Protective Services or to law enforcement, depending on who the person is reporting to. There's a multidisciplinary team that basically all works together, and that involves the Department of Social Services, law enforcement, prosecutors, medical professionals, so doctors, counselors, whatever medical staff you need, depending on the kind of case it is. And everybody works the case together. And through the Child Advocacy Center, what happens is it's based on a national standard. Child is interviewed just once. Everybody else kind of watches it, so we don't re-traumatize a child and make them go over what happened over and over again to every different agency. And it's all hands on deck, so you can listen to what the child has to say, determine what services are appropriate, determine how can the child be the most safe. Is it in-home with services? Is it removal from the home? And then you determine, do we need to have a criminal prosecution? Can it be done through the SINA courts, which is a child in need of assistance, through the family law court system? And everybody, though, is working together so that all resources in Calvert County would be available for that child when a report comes in.
Jennifer Moreland, did you have a comment to add to that?
Yeah, I also just wanted to add that I think it's really important to educate individuals about what abuse looks like and have that continuing education for each population. I can say for Office on Aging, we always have a monthly topic that we bring to our senior participants so that they can understand what to look for. Because, especially with things that are more complex like financial exploitation, it can be really difficult to know when you are being taken advantage of or abused in that way. And then also what to do, what steps they should take. So I think that continual education for at least, for our focus being seniors, I think it's critical.
And can you just explain, because I think a lot of people don't know that there is a family and children network that meets monthly, and who encompasses that network, and how do you share information for that?
So the local care team that meets over cases when there are situations and potential out-of-state placements for kids with behavioral health needs. There's a local care team that meets, and it's a group that meets with representatives from every agency, as well as with peers and parents that review cases. And certainly those cases, and there are some times where we will have sibling abuse come up. So it's interesting. Those are really difficult cases, and you have to look at what kinds of programs you can put in place, community-based programs that will help prevent or treat the issues that are happening in the home. So a good example is there's an in-home intervention program in Calvert County that works closely with families to look at their home environment and what kind of practices that they could put in place that would be more supportive for a child with behavioral health needs, and maybe, support the other children that are in the home as well. So abuse happens in different ways, and I don't think that sibling abuse topic is often brought up, but we've had cases where parents have feared for their other child's life in the household as a result of a sibling that had extreme behavioral health problems that led to violence.
Catherine?
Muted again. To highlight Jennifer Moreland's point, on a national level, when it comes to reported child abuse, 20 to 25% are actually abused or an older sibling. So that's a national wise, all child abuse reported 20 to 25% are by another child in the home.
While we have you, Catherine, can you speak to just what are the mandatory reporting? I mean, when someone is thinking that there may be, what is the situation that really requires it is mandatory in terms of reporting?
So one, I would just point out that there's the National Children's Alliance, and anybody can go to, it's just nationalchildren'salliance.org. It's a wonderful resource. It actually sets the national standards for child advocacy centers, but it has great resources for identifying signs and symptoms of child abuse. With regard to mandatory reporting, so certain jobs require mandatory reporting, and individuals who are mandatory reporters should be trained on that. But teachers, mental health providers, doctors, EMS workers, law enforcement, these are just to name a few. Most religious organizations now are all mandatory reporters as well. And they are mandatory to report, and the report actually goes to the local Department of Social Services. So in Calvert County, their report would go to the Department of Social Services right in Prince Frederick. Any child abuse or neglect. And so if a child makes a report of being abused at the home, or that there's not food in the home, they don't have in the wintertime heat or running water, things like that, those get reported. All of those cases through mandatory reporting of abuse or neglect to the Department of Social Services. Now, some of the things I mentioned, like not having running water or heat, may be because of lack of services. And so although they come in as a neglect report, it's not open as a criminal neglect. It's open to see how can the county or the community help to provide the appropriate resources to that family. But mandatory reporters need to report all of those.
Jennifer?
Which Jennifer?
Jennifer Moreland, did you want to add to that?
That exists for all of our Office on Aging case managers and social workers, obviously through Department of Social Services as well. So, I think it's important to know that those protocols exist for all ages and all types of abuse in terms of mandatory reporting. And nope, I guess that's it for me.
Jen?
I'd like to add that one doesn't have to be a mandatory reporter to call Child Protective Services and bring up a concern they have, maybe about a neighbor or a child they see around their neighborhood they can call and explain their concerns and remain anonymous as well. And like Catherine said, that, you know, doesn't necessarily lead to criminal charges, but it could open up the door to help that family gain further services that they could need to benefit the child.
And what about domestic violence in terms of adults and spouses? If you suspect something is happening with a neighbor, what is the situation? How is that different from what you just said about your suspicion for a case of children?
The difficulty, I would think, is part of the stigma of letting the neighbor's business be the neighbor's business. If it's between adults, we tend to get less involved. But simply that could make a difference in someone's life. And when we train on that, we say, first, keep yourself safe, because you never know for sure what's going on. But certainly people can call our hotline and say, hey, I see this going on next door. How can I help? Can I get more information? What are things I can do to try to help this individual out?
Catherine?
Say that an individual who calls 911 out of concern from what they're hearing or seeing, if nothing comes out of it, that 911 call actually acts as anonymous as well. It's not like law enforcement or EMS go knocking on the door saying, the person 2 houses up called this in. And so it's one of those things that if it's enough to concern you that somebody's safety is at harm or at risk, then make the call if it is concerning enough for that. Some of it is educating yourself to signs and symptoms. For example, one of the things that often gets missed is animal abuse and its direct correlation to domestic violence. And so understanding that seeing something like animal abuse going on in the backyard means there's a heightened risk for domestic violence in the home. And maybe if you do have a friendship with that family there, develop code words. You know, one of the things that was going around, which I thought was absolutely wonderful during this pandemic, is you put it out there as, hey, if you ever ask for, you know, one example was my recipe for making bread. I know that you are in a high risk situation right now, and I'm going to make myself available. I'm going to stay available. And then if you call or you text or you email about, can I borrow some flour? I know I need to call 911. And so if you are in a neighborhood, if you're there, you're seeing some of these signs and symptoms, just let people know you're available. Establish some of those code words so that they know there's a safe person to reach out to, because maybe the person in the situation cannot call 911, but they can certainly ask for a recipe, or they can ask to borrow an ingredient.
I know during the pandemic, early on, too, in other countries as well, there was what they called a Mask 19 campaign. And that was if someone asked for a Mask 19, went to a pharmacy, went to a grocery store, that was to be a signal also that they needed some kind of help, and they needed help at home that they weren't getting otherwise. And actually, until it became widely known, it was one of those that was spreading in terms of trying to find ways, and other people in other fields or that you just might encounter. If you're limited, but you still have to go to the grocery store, is there a way to educate those in pharmacies and grocery stores, or mail deliverers, or package people or something, just the post office people that you might have an opportunity to encounter and some way be able to send signals. So there have been different campaigns, I know, in many places trying to identify where are the places, even in the pandemic, even when people are more or less limited at home, how can they reach out and in what way? And so different social service and other campaigns, groups that care about these issues have been trying to find ways to send and educate different groups of people we might not think of, to also be able to at least help identify where there might be a need for help. Jennifer.
Moreland?
Yes. Yeah. I was calling you. Yes. Jennifer Moreland.
I just wanted to point out how valuable the hotline, the crisis hotline, can be for getting guidance on the right questions to ask or how to navigate a situation. So you don't always have to be the individual that's experiencing the abuse to call the hotline. You can call on behalf of someone else and get counsel on how to approach them. And because they may not be ready to make the call themselves, but you can act as a friend and support them in reaching that decision. And I think the crisis hotline is valuable in that respect.
I think there often is concern about reaching out, especially to law enforcement or to child protective services, that you might stir up something that would be a problem or a different kind of problem or a problem for someone. And I just wonder, we've been in lots of discussions and observation about relationship of police with citizens right now. But can any or all of you speak to the situation? We have both the county sheriff's office and the state police in the county, who are both quite visible as law enforcement agencies. And can you speak to how that has related to your work or to the concerns that we're raising?
So I'll go first.
Oh, Catherine.
The law enforcement in Calvert County, I know from experience, they have significant training with regard to domestic violence, child abuse, and elder abuse. In fact, there's a specific detective who deals just with elder abuse, both physical elder abuse and financial elder abuse. And I will tell you, in Calvert County, many of the cases where law enforcement has gotten involved with the financial exploitation, they actually resolved through the family and through other means, without having to make a criminal case out of it. And sometimes it's, you know, reaching out, explaining, hey, one, you can't do this, and they can stop an act before it happens. In Calvert County, they had an individual who was trying to do a mortgage on their mother's home and then take all the equity out, which is everything that elderly woman had to live on.
Sure.
And it was because in Calvert County, there is a team specifically for elder abuse that works together, and they've done training, that the bank teller realized there's something wrong with this application and how it's going about. And they were able to contact law enforcement, who was just, and that detective was able to reach out to the bank that was doing the mortgage and saying, wait a second, these signatures aren't matching. The bank stopped it right then, and they were able to resolve it. And the underlying issue on that case ended up being her son had a significant substance abuse problem. And so it was resolved by getting that son into the proper substance abuse services. The mortgage never went through, and the elderly woman's resources were protected, but the proper help was put in place. And so they've had significant training along those lines. The other thing is, as Jennifer said, if you call the hotline, they will provide services. So if somebody's concerned about a family member or a friend, and they can give them tips and things like that, some of the things is just letting law enforcement know, hey, this seems to be escalating. I'm observing this. And one of the things law enforcement does is just increase drive-bys in that area, so that if anything is observed or heard, they're right there in the area and they can respond promptly. So it doesn't have to involve an arrest. It can simply be reaching out, finding out, how can I use these resources to help connect people to the right help that they need.
I wanted to,
yeah.
Oh, I wanted to add, so in 2018, the Families First Prevention Services Act was passed, and that is really going to change the child welfare system dramatically. So it is really incentivizing, putting programs in place for families, therapeutic programs, substance abuse, evidence-based parenting, mental health, parenting services, all these programs in place to support families instead of putting children in the child welfare system in foster care. But it's incentivizing all that prevention, which prevention is what we need. It's what we need as a system so that we can stop the cycle of violence. So when we look at you know, adults who have significant mental health, substance abuse issues. There's this framework, adverse childhood experiences. It's a screening process, and violence is one of those things that comes up in that screening process, and oftentimes leads to substance abuse and behavioral health issues later in life, and health issues like heart disease. So it's really, really important that we have all these prevention programs in place for families, because I genuinely believe families want to do right, but these practices, you know, for addressing, you know, behavior are things that are learned and taught over generations, and they have to be unlearned, and new practices have to be put in place. Positive practices have to be put in place. So I think the change in the welfare system, I hope, will really start to address this cycle of violence in families, and we'll see. I think this year is when we'll start to see those real changes in our local social services and how they do business.
Just quickly,
Jennifer Edwards.
I was going to say just one point to Jennifer Moreland's point when she mentioned adverse childhood experiences. It's kind of known as ACEs, and it does long-term health impacts such as high blood pressure, heart disease, diabetes. And for that, I just recommend anybody go to the cdc.gov and under search, put in ACEs. You can actually take it's a 10-question little survey yourself. And, you know, it's 4 or more ACEs in your life put you at higher risk for some of these long-term health concerns. It tells you how you can reduce your risk for those. So again, just the cdc.gov and just put in the search engine ACEs, and
ACEs stands again for?
Adverse childhood experiences.
I was going to ask Jennifer Edwards. I know the Crisis Center has various kinds of workshops, and they are for different purposes, including perpetrators who have, or anger management kinds of workshops. Can you speak to those too, and how does one get involved or encourage people to actually take that?
Certainly. So one of the programs that Crisis Intervention Center runs is called the Alternatives Abuse Intervention Program. That is a 26-week or 6-month psychoeducation program. I currently run that right now. We have court-ordered men who come in. And so what we concentrate on is educating them about what abuse looks like, the cycle of violence, communication skills. We try to break down those long-term generational poor choices of how they interact under stress with loved ones, with children, and replace them with better choices. Better communication is key. Better understanding of one's boundaries and others' boundaries are key. So we have that group currently running at Crisis Intervention Center. We're looking to start a women's abuse intervention group. And we also have support groups for survivors of domestic violence and sexual assault. But they can call that main number, the 1121 number, and get further information about how to be a part of that or how to join.
For the one that deals with people who to learn better anger management, are there mostly people volunteer, or is that court ordered? Who actually takes that?
Generally, the one for the Alternatives Abuse Intervention, it's primarily court ordered, but we do have volunteer individuals that join. And I should say, in the domestic violence community, the ideology is that an individual acts out in a violent way, not because he or she is angry, but because they're looking for power and control over another individual. So there are general anger management programs that'll help you with road rage or things like that. And then there's these very specified programs like the AIP at Crisis Intervention that deals with individuals struggling with their own abusive behaviors.
Catherine, I wonder if you could, we can shift just for a minute and you can talk a little bit about some new trends or available legislation. Where is Maryland on some of these issues? In some I know we've been ahead and in some we've been behind. So what can you do to tell us or update us on some of those points?
Well, that's pretty accurate. Some we've been behind, a couple things we've been ahead. But for this year, so what passed was to make strangulation a felony. And that'll take effect as of October 1. Prior to that, 47 states, not Maryland, but 47 other states had strangulation as a specific enumerated felony. Maryland did not. We had to show it. We have first or second degree assault. And for a first degree assault, we have to either show a permanent protracted injury or the intent to cause that. And a lot of times with strangulation, the survivor doesn't seek a medical treatment right away, or there may be just external marks, so it was hard to do that. But one of the things that the statistic shows us with strangulation is an individual who has been strangled in a domestic violence situation is 750 times more likely to become a victim of domestic violence homicide. So just that single act of being strangled once before in a domestic violence situation puts him at 750 times greater risk to be killed in a domestic violence situation. We've also learned that individuals who strangle in a domestic violence situation are more likely to kill their partner, to kill a child, or to kill law enforcement in response to that situation. One of the greater concerns and why their legislation pushed to make this a felony is because of that high lethality risk, but also to make sure that the proper follow-up can be done for the victims. So traditionally right now as it stands, only 3% of victims who are strangled actually seek medical care or treatment. But what we know is a lot of times where there may not be signs on the outside of the neck, there can be internal damage, and that victims of strangulation are at a higher risk for stroke, brain damage, and multi-organ failure days, weeks, months, and even years later because of the strangulation incident. Because it can cause actual damage to the carotid or brachial arteries, and without going to get the proper scans from the hospital and to be treated, there's no way to know if that's happened. I will say that by passing this legislation, by making it now, so first or felony assault was if somebody ever pointed a gun at somebody, that was a heightened felony, a heightened assault. They're now making strangulation the exact same way. And so that does take effect October 1, but protocols are changing. And when we talk about individuals, you know, being that ally or being that friend, those are things you need to know. So if a victim, if they tell you your friend or loved one has said, you know, he choked me out, although it's actual strangulation, but if they say that, it's making sure you let them know about these heightened medical concerns so that they can get the proper follow-up medical care, because we don't want somebody to be dead a week after a strangulation incident because there was internal damage that we weren't aware of. The other thing that passed, quite frankly, which had been pushed for many years, I know by the Crisis Intervention Center, was that individuals of sexual assault are now eligible to file for a protective order. Before, they could only file for a peace order, which was good for 6 months. They had to pay for it themselves. Now, victims of sexual assault can go and get a protective order. They don't have to pay for it. It's good for a year. And depending on criminal outcomes of sexual assault, it can actually be renewed up to the survivor's lifetime. So those were two great things that made it out of legislation and become law in Maryland this year.
Good. And is there anything on the horizon that is kind of the next one that people should be aware of just for a new year of legislative activity?
So there's always new things.
I know that.
One of the things that we're really working on within the domestic violence field is to work on our stalking laws in Maryland. They're kind of woefully inept with regard to how invasive stalking is, and when you look at potential outcomes of stalking. So we're not talking about that person who just calls repeatedly, but we're talking about that person who follows somebody or puts a GPS tracker on their phone or their car and has literally spent all of this time following every aspect of the individual. we know that an individual who puts that much time in, the outcomes are likely much more dire. And so we need to get our stalking laws to match what that crime actually brings about. And that's one of the things that we're working on for the next legislative session.
Maybe we should stop. We could, I know, cover a lot more things, but I want to just check and see if we have had any questions from those observing that we should also welcome and respond to.
Joan, we do not have any questions.
Okay. Well, then let me just ask in terms of where we are with social distancing right now and the changes with that, or it may or may not, we may continue to see a opening up and more people out. Beyond just the expectation that people mentioned of calls and cases. Now, is there any advice that you might give in terms of how, or resources, ideas that you have come across or think of that people can either participate and do themselves or encourage others to think about as we're opening up, hopefully, and we may clamp down again, so we'll have to see. But particularly if we bring it back to the pandemic, let's think about that. Jennifer Moreland.
So ideas for the community to engage more in this discussion. I think on social media, of course, we've seen a lot over the past few months, and it's been very overwhelming. But I think one of the reasons why you are having this is to talk more about this problem and to bring it to the center stage. And so I think what we can do as a system is just continue to share information and make this topic prominent, whether it's on social media, whether it's on, we operate at ourcalvert.com in partnership with several other nonprofit partners. We'd love to see more virtual programming shared on ourcalvert.com under events and flyers and educational topics. There's certainly a lot of resources on ourcalvert.com that are continually getting updated. But I just think the critical thing is continuing to share these resources during this time. I don't know when the senior centers will open back up. I think we are last on the list. So I think it's going to be really important to be creative on how to get resources to our seniors. Some of them are absolutely tech savvy and are using that Facebook and Twitter. And then others don't have an email account. So there is quite a range in how we have to connect with our seniors in this community. And what we are going to continue to have staff do that would normally be working with our seniors in the senior centers is to reach out and call seniors that would normally be coming to our senior centers, connecting with them, making sure they have everything they need, and continuing to maintain that line of communication.
Catherine?
So I think one of the things is just to get educated, and one, to know that I think what we all work for the most is take away the stigma of domestic violence, that it shouldn't be something that has to stay in the home, and to let everybody know it's okay to get help and it's okay to seek more information. So we talked about the National Children's Alliance. There's also just the hotline.org, which is the National Domestic Violence Hotline. It goes through signs and symptoms. There's ways to be involved. And Jennifer Edwards can talk more about it with regard to volunteering and victim advocacy work through the Crisis Intervention Center that they do trainings at least twice a year on. If individuals want to get involved with regard to children who need assistance, there's the CASA program, which is a court-appointed special advocate program, and they do trainings right here in the county. And if you go through that, you get approved, you go through the training, then you're going to be assigned to help a family through the court process for a child. So that's a child in need of assistance. And as a CASA worker, your job is just to make sure that the children's wants and desires get put before the court, so that you're a voice for kids and what they want. So we have amazing resources in Calvert County and the Southern Maryland area in general. And so some of that is just making sure you know what they are and how you might want to help.
Good. And Jennifer Edwards.
And I'm just going to first back what Catherine said. I believe education is key. And so we provide multiple media type outlets, things like that. Our Facebook page, please check it out, Instagram. The Crisis Intervention Center does have a volunteer program, like Catherine mentioned, and we do 2 12-hour trainings a year. The one in April focuses on sexual violence, and the one in October focuses on domestic violence, the signs and symptoms, how you as an advocate can help. We train you to go out to the hospital if a survivor shows up there, to be with them and be that voice that knows how the process is going to work at the hospital, or report to the commissioner's office to help them with a protective order at 2 a.m. We have opened the volunteer advocate program up to anything. We want people to have a voice. We want to hear from you. And like Catherine said, we have some wonderful, wonderful resources in our county. So just reach out. Don't hesitate to ask.
I just want to mention and reinforce the fact that violence in the home can affect all people. It can be all levels of education, of income, of race, of sexual orientation, of all people throughout our society. I've done international work. The estimates that the UN has is that 1 in 3 women face violence at some time during their life. That's a huge pandemic in terms of the kind of health impact it has, the economic impact it has, the impact it has on children. And there is, as we talk about redirecting potentially some funds in different ways, there are things that, again, we can think of in terms of social and programs that we have, health-related programs that we have that can help address some of the issues that we've been talking about today. For those people who have been watching, should you or anyone know of someone who might be facing violence in the home, please contact any of the resources that we've discussed by phone, by text, by email, or look online. Look on the our calvert.com, the community resources, or the crisis intervention websites. And please make sure that you and those you care about are aware of these services locally and beyond. I want to reiterate something Catherine said, and I know that she posted it on her Facebook at one point a little earlier this spring, just to say the crisis intervention, the hotlines, the doors are never closed, 365 days a year. The phones are never not answered. And the courts are never closed for victims of child abuse, domestic violence, and sexual assault. These things can be what we think of as small, but they can be emotional forms of abuse. In this pandemic, it can be someone threatening or posing, pulling down your mask or coughing on you, as well as physically reaching out. For elders, we know that as people age, they bruise more easily, they fall more easily, they break a bone more easily, but that may or may not, in fact, be just because it happens, or it may be a case of abuse. So there are lots of things that we can educate ourselves on to think about these things. And I would just want to thank the library again for hosting the commission and us today as we talk about these things. And to also just encourage people that the Commission for Women, it was created and stands ready to respond to all our citizens in the county and beyond on this issue and others. We welcome your ideas, your concerns, as well as the positive and celebrations that we should recognize as well. And we will continue to seek ways that we can help represent women and girls and all people in the county so that we can address some of these issues that we face today. Thank you for watching, and thank you again to the library.
Thank you so much for joining us. This had so much valuable information, and I know it will provide a lot of resources for our community.